Everybody, welcome back to Local 4 Live. I'm Nick Monticelli. Thank you so much for watching. 1 in 8 women in the U.S. will be diagnosed with invasive breast cancer, according to the American Cancer Society. And typically it has no symptoms when it's small and easily treated, which is why mammography screenings are so important for early detections. It's one of the many important messages you're going to hear this Breast Cancer Awareness Month. Joining me in studio to talk about this is a 5-year breast cancer survivor. This is Nikoa Dean and Dr. Mihaela-Elena Rapolti. Did I get it right?
Correct.
Oh my gosh, I tried so hard. She's a reconstructive plastic surgeon with the Carmanis Cancer Institute. Thank you so much for being here. And I know this month is incredibly important. It's important all year long, but this month especially. Nicole, I want to start with your story because you are unique in the fact that it sounds like you were pretty adamant about getting your screenings, then missed one because of COVID. Yes. Is that right?
Yes.
So how'd that all play out?
So I was supposed to go to the doctor in December.
Okay.
It got canceled.
Okay. Oh, 2020?
Of 2019.
2019, okay.
It had got canceled. Right around April or May, my chest started hurting. I said, oh, okay, I have to call now.
Right.
So I called, went in, and they said, you have to come back for the ultrasound. I went back for the ultrasound. Then they told me I got to come back for the biopsy. Went back for the biopsy, and about 2-3 days later, got the call and said, hey, we need you to come back in.
Okay.
When I went back in, that is when they told me that I had stage 0 breast cancer.
Okay, I've never heard of that, but I also want to ask you, during that process, when they keep asking you to come back over and over again, with little information, your mind must have been racing down some dark rabbit holes.
Of course, but for some reason, something told me that I had it.
Okay.
So I
kinda
was ready for it.
Yeah.
So when I went in, and she told me, yes, it's positive, you have breast cancer. I am human.
Yeah.
So I hit the table, I cried, but I also said, what's the plan?
Okay.
Okay? Because we need to get right on it.
Right.
We don't need to wait.
Yep.
We need to find out what the plan is, okay?
Strap me in a chair and give me some treatment right now.
So, my case is so differently from everybody else's.
Okay. Because of it's stage 0?
Yes.
Okay. What does that mean?
It's there, but it's just there. It didn't spread.
Okay.
Okay.
So you were very lucky then.
Lucky and early. That's how come it's so important to get tested early, because your chances of a successful rate is higher.
Okay.
Versus you waiting.
Right. So, doctor, I want to ask you too, when it's caught that early at stage 0, which I didn't even know was a thing until now, what does that do in terms of treatment options and prognosis?
I am part of the multidisciplinary breast cancer team at Carmanis Cancer Center.
Okay.
I want to set up the scene first.
Yes.
Okay.
You are legit. You know what you're talking about.
I'm one of the many other doctors. So this team is composed of many other doctors and healthcare providers. Some of them are surgical oncologists.
Okay.
Some of them are medical oncologists. Some of them are radiologists, radiotherapists. Some of them are pathologists, women's health nurses. And so all this team is part of the diagnosing of cancer, starting with the mammogram, continuing with pathology and so on. And the treatment basically is elaborated based on NCC and guidelines, depending on the stage. For her situation, Ms. Dean really was very lucky to catch it very early. The treatment in general is to remove the tumor, okay? This can be done based on doctor's discussion with her, and that will not be me. Plastic surgeons are just reconstructing the breast. And the options are from lumpectomy to mastectomy to what she chose to have bilateral mastectomy in specific cases, and also other treatments. Hormonal therapy, that's not my specialty.
Sure.
So all this team, together with Ms. Dean and in general with patient, decide about the treatment. So they are part of the treatment.
So when you have a whole team of people surrounding you, I'm sure it can be overwhelming because you've got a lot of people to talk to, but does it also help because it's not just you versus cancer?
It helped but I knew what I wanted to do,
Which was what?
which was have a double mastectomy. I didn't have to have chemo. I didn't have to have radiation. It's just go into surgery, have the surgery, and then that's it.
That's it. Was that a difficult decision?
No, not for me.
Okay.
Okay.
I know many women have many
Because
different.
I knew who I was,
Okay.
and I stood over on my faith. I am a faith believer, and it's all about what you put over in your mindset. So I didn't have to worry about it. I didn't think about it, and it did not cross my mind in 90 days that I had breast cancer. Yeah, I can say that, and some can't.
Oh, right, some can't.
That was from the beginning when they told me that I had breast cancer up until the time that I had the surgery. It was 90 days.
Right. So I know your specialty is the reconstruction then. I've heard that many more women are opting for a double mastectomy, not necessarily because they have to, because it is one of the best routes just to get rid of it. But then on the flip side of that, where you come in, is to kind of rebuild things. How far has how far have the advancements come that it's an easier decision for women to make because you can reconstruct?
That's a good question. Discussing about breast reconstruction, I just have to remind that yesterday was the BRA Day, Breast Reconstruction Awareness Day. So women are protected by Women's Health and Cancer Rights Act to have plastic surgery consultation even before having any breast surgery to know their options.
Right.
Because there is just not only one option. There are multiple options, and patients are part of the decision. Irrespective of what we recommend, some patients want to just stay flat. Some patients want to have oncoplastic procedure, like just a piece of breast is removed and the rest is reshaped in the shape of a breast. But some people want to have complete mastectomy and not go flat. And that means that they will need some kind of reconstruction. Options are at this time to have a reconstruction with their own tissue, as Ms. Dean chose to have. So some part of their body has a little bit of excess, the skin and fat, and that's moved at the level of the breast, different type of procedures.
So take it from here and put it there.
Kind of, very simple. And also implant reconstruction. So this, the same type, almost the same type of implant, breast implant that are used for other cosmetic procedures are used to reconstruct the breast, and also a combination of both of them.
Okay.
So of course there are benefits and risks with each of them, and patients are part of this. There is not
Part
just
of the conversation.
Part of the conversation. They have different priorities in life. There are different advantages of this procedure or the other procedure. Some people don't have downtime to deal with this, and they choose implant. But you know that implants have specific risks. That they are not lifetime devices. The longer the patient lives, and these days cancer is curable, basically they have risk of complication. There are very rare two types of cancer associated with the implants and so on. But the other type of reconstruction requires a long downtime, multiple procedures to revise, but this is for an entire life.
Right. We are out of time, but I want to just very quickly just ask you and kind of remind people that you caught yours very early.
Yes.
And actually paid attention to it as to ignoring a symptom. So why is that so important to not ignore what your body is telling you?
Because your body tells you something.
Right.
When something's not together and when something is off, go get checked.
Yeah. Don't
It's
ignore
so
the warning
important.
signs. Go talk to your doctor. Fingers crossed, maybe it's nothing, right? But
Yes.
go talk to your doctor. Thank you so much. We are totally out of time. I apologize, but what a great conversation, especially to have during this month.